Point being is that the diagnoses in real life are a lot more messy. And the last point I wanted to cover is diagnosis. So in the textbook, they're always a clean diagnosis. So what does this mean? Okay, this means, okay, the patient either has depression, anxiety, or they might have PTSD, or they have BPD, borderline personality, or whatever it is. However, in real life, I'll write blended diagnoses. So anyone who's worked with patients can tell you that, okay, the patient might have a little bit of PTSD here and a little bit of ADHD and some depression, and then there's like some personality disorder that's thrown in. So diagnoses in real life are way more messy. Point being is that the diagnoses in real life are a lot more messy. Stigma with diagnoses. So what does this mean? So I've noticed that in a lot of psychiatry practices, there's some diagnoses we hesitate to make more than others. Point being is that these are the kind of dilemmas you run into in real life. Or if I diagnose with BPD, borderline personality, that's kind of different than just saying, oh, you have some anxiety problems. And a lot of people are hesitant to do that. They don't want to have that stigma, or they don't want the patient to feel like they were diagnosed with this thing. So we may hesitate to diagnose some things that we know we should be diagnosing because of the stigma or how the patient will perceive it, or we don't want to cause anger or trauma within the patient.